Welcome to LCCAP Legacy, Decades of Dedication, the podcast that celebrates the incredible individuals who have shaped the heart and soul of the Lawrence County Community Action Partnership.
Each episode, we'll dive deep into the stories of those who have devoted their careers to making a difference, not just in our organization, but in the lives of the people we serve every day.
We'll uncover their journeys, explore the moments that inspire them, and highlight the lasting impact of their commitment to LCCAP's mission.
So whether you're here to learn, be inspired, or simply celebrate the amazing people who make LCCAP what it is, thank you for joining us.
This is LCCAP Legacy, Decades of Dedication.
Let's get started with today's guest.
Hello, everybody. Happy December. Hope everyone's having a great start to the holiday season. I'm with my two wonderful co-hosts, Amber and Janae.
Hello.
Hello.
And we have a wonderful guest on today, Jordan Garrett from
Hello.
our health office from Early Learning. So welcome. We're so happy to have you here.
Thank you. It's nice to be here. Thank you for having me.
Thanks for coming in. So tell us a little bit about yourself, Jordan. How did you get started here at Lawrence County Community Action Partnership at our Early Learning Center?
I was looking for a job right after the world opened back up after COVID. I had stayed home because my mom was going through chemo for breast cancer, so it was actually a pretty convenient time for us to be home. Nobody had to go anywhere, so we were able to stay safe, stay healthy. Everything's good to go. So once the world opened back up and everybody was healthy, started job searching. And I've always loved children. I have always babysat as summer jobs. My sister's 10 years older than me, so I became an aunt when I was 15. And I have 5 now, 1 niece, 4 nephews, and I've just always loved them. I've babysat them since they were little kids. And I don't have any kids of my own yet, so being at Ben Franklin and visiting all the different sites is like filling that little hole for me.
Nice.
Sweet.
And your current title is Family and Health Services Specialist. So what does that role entail?
So I work closely, of course, with the health office. I started out as the health office's assistant. And as that role expanded, we realized we were working a lot more with the different departments than we were with just health. So we work a lot with family services. We plan family nights. We do a bunch of different services for the families. And then I also work very closely with nutrition. We purchase all of the baby foods, formulas. We do senior food distribution for the low-income seniors in the area once a month. So I help out with all of those little things.
So what are some of the most common needs or challenges that you see among the families that you work with?
I would say sometimes it's access to transportation, because we do screening for hearing, vision, lead, and hemoglobin in the health office. And when we get a screen that comes back as a medical referral, we obviously always tell the parent that we recommend that they follow up with the doctor, because we can only screen. We're not doctors. They can do a legitimate exam. And some of them have a really hard time finding transportation to get to those places. So we try to work with MATP, the Medical Assistance Transportation Program through ACTS. They can help out those families when they need those transportation services. So we do try to get in touch with them. Some of them also are a little bit wary about us doing those screens without them being present. They're used to going to the doctor's office and being there and holding their children's hands. So we also, in their consent forms, they can sign off saying, I want to be there for the screen. So we'll call them, we schedule them, they'll come in, and we'll do the screens with them right there in person, which is really nice. I think that's something else that parents struggle with, is not being able to be there for something that they see as really important.
Yes, and that is really important. And it's the kids, too, they might feel a little scared without, their parents being there. So that's nice that you have that option available for the parents to be able to be there during something like that.
Yeah, I think it makes everybody a little more comfortable.
Mm-hmm, definitely. And Jordan, what are some key health practices or routines that Early Learning puts into place to keep our children safe and healthy?
Well, we have lots of hand washing routines, and that's not just for the children, it's also for staff. If they're changing diapers, they're washing hands before, putting on gloves, and washing hands after. We have lots of cleanup procedures. Each room gets disinfected and cleaned at the end of every day by custodial staff. We try to avoid any sort of incidents by filling out accident forms for every single little injury that happens so that the parent is aware of every tiny little scrape or bruise that happened to their child during the day. They're going to be aware of exactly what happened and make sure that there is a way to make it not happen again. We put something in there, the corrective action, to make sure that the behavior doesn't reoccur. So that's something that we're always looking for in active supervision, to pay a little bit better attention.
Your work blends family support and health services, which are two big worlds. What's something that you learned about the connection between the two that most people don't realize?
Well, we work really, really close with families when we are trying to obtain necessary documentation. So when we're trying to look for physicals, dentals, we have a deadline that they have to have that done within 90 days of enrollment. So we work really closely with those families and with the doctor's offices trying to obtain that information. Sometimes the families struggle actually getting the information, so we're able to talk to them, then talk to the doctor's office, and then get them to fax the information to us. So we are working with the families pretty closely with that. And also with family nights. We plan those family nights with the family service workers, and we try to get as many families to come as possible. We usually have 3 different class activities that the parents can learn something while they're doing a craft or activity with their child, as well as a little cooking class that they usually get to go home with a recipe to work with their kiddo for, which is always great.
And how do you support families when there are concerns that are identified in the different screenings that you do?
Yeah, so if they have any sort of concerns, we make sure that they have our phone number at the bottom of the paper that we send home with them. They can call us and talk to us, ask us exactly what it was. If it was a hearing screen that didn't pass, we can actually send them the printout for the actual screen. It'll tell them how many hertz they passed, how many hertz they didn't pass. So we can give them all of the little specifics of that.
So, Jordan, we're now in the cold and flu season during, these winter months.
Of course.
So what do you wish more parents knew about sending their children to school when they're not feeling well?
Well, if you feel like your child is excessively snotty, coughing, sneezing, it's probably a better idea to keep them home. Not just because they're coughing and sneezing, but all of their classmates are probably doing the same thing. And we don't want it to get any worse than it is. There could be more than one cold in that classroom at a time, or suddenly somebody comes in with stomach flu symptoms and you're still in there with a cold. Now you have all those symptoms. So it would be nice if you feel like there's excessive sickness to make sure they're at home. If they have a fever above 100.4, they should always stay at home. If they have an undiagnosed rash, they need to be seen by a doctor before they can come to school.
Yeah, this time of the year is not only tough for the kids, but also for the teachers. My mom's a school teacher, and she always gets sick around this time of year because the kids are just coughing and sneezing. Yep. And it's just like, germs everywhere.
Yep, yes. I've got a cold right now. So
And then when you feel better, you'll catch it again just in a couple days.
Just in time for Thanksgiving.
And also, too, another thing that that the health office does, too, for the teachers is they send out the health alerts, the sickness alerts. So then all parents know, this is what's going on in the classrooms. Just be aware that, you may catch it or your child may catch it. So I like that, too.
Yeah, if there's 2 children in a classroom that are having the same symptoms for the same illness, we're going to send that illness alert home. We send a printout for all the parents. If there's Spanish-speaking families in that room, we make sure that there's some Spanish ones printed out also so that everybody has a precise idea of exactly what's going around. If it's in more than one classroom, we're noticing 2 kids and it's the same illness, we usually send one for the whole building so everybody knows. Even if it's not in your kid's classroom yet, it's spreading around. Be careful.
And just going back to the beginning of our conversation, you mentioned how you adore kids. So talking about your childhood, how did your childhood and upbringing shape the way that you approach your work today?
So my mom was a stay-at-home mom. I was the youngest of 3 by quite a few years, so I spent a lot of time with just me and my mom growing up, and she babysat a lot of other kids. So I got to spend time at other kids' houses while my mom babysat them, and it kind of just became a normal experience to be over at people's houses playing with their kids. So as I got older, I figured, if I need a job during the summer in between my college classes or in the winter, then I can do that. And then when my sister had twins my freshman year of college and she had to go back to school as a teacher, I would, for winter break, summer break, babysit the twins and her 3-year-old. And that was wonderful. So I knew that I could keep doing that with a much bigger group.
So how do you measure success in your role?
Well, we try to get all of our screens done, passed. We want all of the results. So if we have any sort of medical referral screens, we are asking the parent in the doctor's office for results. If they go and they get a rescreen at the doctor's office, they may pass and our screening wasn't a correct one for them. That's fine. That's why we send them to the doctor. So if we get all of those back, we see their results, whether they're a pass or if they're a referral to a specialist, then we can make sure that they're on track to getting what they need. So if they actually do need a specialist for hearing, vision, anything like that, we're making sure that they're actually getting connected with the Department of Audiology, et cetera. So getting all of those screens done and within that 90-day period is definitely what we're striving for at any time.
And what skills or milestones are you most excited to help children develop?
I really like to help them with, socialization. I feel like a lot of the kids, they really are only familiar with their own families, especially post-COVID. There's a lot of families that don't really go out a lot, don't really travel. So when they're coming to school, it's kind of their first experience with new people, not only new children, but also new adults. So you're giving them new experiences, showing them what different adults can even be like in their life. So we try to give them positive experiences. We talk them through when they're going through their screens and if they're a little bit nervous, because we are poking the finger when it comes to doing their lead and hemoglobin draw. If they're a little bit nervous, we make sure we're holding their hand, we're telling them exactly what's going to happen, and we're making sure they're aware that they are brave, that they're safe, and that we are there for them. And once they're done, they have their chance to calm down, they pick out a sticker, and they feel so proud of themselves. And that's something that's really rewarding is we'll walk them back to the classroom and they're showing off their Band-Aid to everybody. Look what I did, look what I did. And I think that's so rewarding when you're like, they were so afraid, but now they know that they can do hard things.
There's nothing like a great Band-Aid, like a cool Band-Aid and picking out your own sticker.
That's right.
The best.
That's right.
I can tell just by the way you're describing your job that you're very passionate about what you do and the people that you get to interact with on a daily. And a lot of those people are parents. So what's the most meaningful thing a parent or guardian has ever said to you so far in your role?
Honestly, I find it really rewarding when they just approach me and they know my name already. And that's usually because I try to know every single kid's name. I'm not always the best at it. We have like 500 children in our program. But I know, at least in Ben Franklin with our few hundred kids there, I know almost all of them by name. I try to talk to them as they're getting picked up by their parents, say hi and bye to them. And so the more you interact with them, the more the parents realize that you're somebody who is there and cares about their child, even though you're not in the classroom. And I feel like that makes them feel even better about where they're bringing their kid and they're leaving their kid for the day, not being with them, not being able to see what's going on. And you know that there's people outside of the classroom that are just as passionate about your children and excited for them to grow and learn.
Absolutely.
Are there any resources that you wish more families were aware that we have here at LCCAP?
Yeah, so we actually have a health services resource guide, and it has all sorts of offices for doctors, for mental health services, and for disability services. I feel like we give that resource guide to a lot of parents at the very beginning of the school year, and they're always surprised by the amount of information that's in there. And I think it would be really great if they were able to have access to all of that on their own. But it's hard to sit there and compile all the information. It takes a while and it has to be updated all the time. So I do wish that they were able to get in touch with specialists and doctor's office a little more often. It's sometimes hard to get in, and especially dental offices, really hard to get in for just a regular exam. So having a resource list like that is super helpful. So I'm hoping that more can request them from us as well that don't know that we even have that.
And speaking of resource lists too, one good thing about our kiddos enrolled in our early learning is that they're a part of Lawrence County Community Action Partnership in general. So we have so many different programs and services and resources available just within our own agency. So that's also another benefit of attending our early learning programs. My daughter, she is in kindergarten now, and she was enrolled at our Frumo location. And I just say pretty much every single day how much I miss it here, how much I miss
Ella too.
Teachers and being engaged and knowing what's going on and seeing the different pictures on Class Dojo and just being a part of, it's like a family. So that's one
family,
thing.
That's what they like to call it, a class family.
Class family, eating together, doing special projects, just all the learning that they do in our classrooms. I sure do miss it. So I wanted to bring that up when, you just mentioned a little bit ago about, seeing the families and saying hello and remembering everybody's name, because it's true. They become part of your family, and you could tell by everybody that works here, the love and, the attention they do give our kids.
So you only have been here for 4 years, but within that 4 years, what has been your favorite thing about working this job?
Oh, just all the children. Every year you get new ones. You get the returners. The returners are so excited to come back and see everybody that they know. They know all the rooms. They're excited to show their new friends everything. So honestly, the beginning of every school year is so exciting. When they're all coming in, they're excited. They're in a new place. They're meeting new people. That's definitely the best part every time.
Those little returners, they're so cute. They're like the big kids of the school. So it's just so cool to see them like when they were little coming in and now to be like the bigger ones. So it's nice to see the transitions.
And just to piggyback off of that question that I just asked, one of the main themes of this podcast is legacy. And I like to ask everyone who joins the show, once you're done with LCAP, what are you hoping that your legacy is that you leave?
I'm hoping that it would be an environment where everybody is still getting to know everybody that closely. I know a lot of people are really overwhelmed during the day, and it's hard to get to know every single child that's in the whole building. But it's really rewarding to do so, even if you're just taking a couple minutes out of the end of your day. You're in the hallways, you're saying bye to some of the kids. I'm hoping that even after I'm gone, that people are still trying to know every single kid that they're passing so that they can say, hey, it's time for your screen, but you know me. You can come to my office with me. You remember me. I think that makes them a lot more comfortable too.
We're going to go ahead and wrap up the personal round and make our way to the quick fire round. And how that works is we're going to ask you a series of questions, and you're just going to answer with whatever comes to your mind first.
Okay.
So, Kim, you want to take it away?
Sure, I would love to. Jordan, if your job was a Starbucks drink, which one would it be and why?
I think a hot chocolate, because it's nice and warm. It doesn't shock you too much with the caffeine or anything. Don't want to be too high energy and scare people off. But it keeps you nice and warm with a little sweet flavor.
That's cute. Nice and cozy.
What is your all-time favorite kid-friendly movie?
How about a holiday movie?
Probably Sleeping Beauty. Sleeping Beauty is my favorite princess. I think she's a very underrated princess. I think it's a cool little story of, hi, I met somebody that I love and I want to be with them and I don't care what my parents think. And they both say that. And then it turns out they're the ones their parents wanted them to marry the whole time.
It's been a long time since I've seen that movie.
It's a good one.
I have to give it a rewatch.
Me too. I feel like I always watch like Cinderella or like all the newer Disney movies. Yeah, we need to go back to all the old classics.
Absolutely.
And Jordan, what's your daily sparkle, the one little thing that makes your workday brighter?
My colored hair. I think it makes me a lot better at my job. It makes the kids really excited when I come into their room. They're like, hi, why is your hair this color? And I say, oh, because I want it to be. Is that okay? They're like, yeah.
Yes.
You should do this color next, which is so much fun. And when we're screening them, it's a nice little distraction for them. Oh, I want to do my hair like that someday. Oh, I bet you could.
It's so pretty, just like Amber's. I was noticing that earlier. You ladies have,
I started out with purple, then I went to blue, pink. Now it's red, and I'm going to go to purple again next week.
It's like a unicorn.
Yeah, exactly.
Yes.
It keeps the kids excited.
So how do you like to spend your free time?
I spend a lot of time with my friends. We like to watch a lot of videos on like history, scientific explanations, like really just learning about the world around us, past, present, and possibly in the future. So I spend a lot of time with my friends, and I think that's really important. Even as you grow older, I think that a lot of the time you stop spending as much time with friends and you start spending time with, a significant other. But I think it's really important that you're still getting at least once a week that you're spending just with your friends.
Keeps the inner child in you.
Absolutely.
Even like traveling. You do a lot of traveling with friends. I think that's so nice to be able to do and just get away and enjoy each other. And like you said, I mean, a couple more years, things could all change. So
Exactly.
having, that togetherness at least, once, twice a week is very important.
Absolutely.
And what is your favorite part of your day, your morning routines? Like, what do you love to do when you get up?
I cuddle with my cats the first thing when I wake up in the morning. I have 2 cats. They are my little babies, and they're everything. So I cuddle with them in the morning. I play with them a little bit. I feed them, and then I unlock their cat door so that they can sprint outside into the snow. And they love it.
They probably just go hopping right through
They
the
do.
snow
They
with their
love
little
it.
paws.
It's so strange.
If LCAP issued trading cards for staff, what would you want your fun fact to be?
I was life flighted in high school.
Oh,
Care to share or?
Yeah, so I was put on a medication for tendinitis. I was in cheerleading and softball at the time, and so I had a tendinitis in my right shoulder. I had a doctor prescribe me basically a really strong Advil, just a strong anti-inflammatory for it. And in just a few weeks, it ate a hole through my stomach. So it gave me an ulcer that perforated, burst. So free air and fluid from my stomach were in my abdomen. An ambulance took me to UPMC in Farrell, and from Farrell, they brought in a helicopter that took me to Children's Hospital in Pittsburgh. So they were able to stitch the hole shut, and I was in the hospital for about a week with that. And really my only lasting effect now is that I can't take Advil because there's a good chance that it could happen again. But other than that, everything is fine. But that is certainly my fun fact.
that's so scary.
Yeah, really scary.
Yeah, and once you're not in pain anymore, the helicopter ride is so cool. Those football fields are like the size of Legos. It is crazy.
Wow. And is there 2 nurses in the pilot, or is it one nurse?
I believe there was just one because my mom got to ride in the front.
Okay, because I know you can't have too many people.
Right.
Yes.
So I was 17 at the time. So because I was still a minor, my mom was able to ride in the front, and she talks about it, the experience. She loved it being in the front of that. She was like, oh, once you weren't in pain anymore, she said, I was just fascinated looking out that window.
It makes for a good story.
Absolutely.
All right. So it's a snow day. How are you spending your day? Are you building a snowman or sledding? Or are you staying bundled up inside?
Well, I'm definitely going to sleep in, first and foremost. I am definitely somebody who loves to sleep in. So that would be the first thing I would do. We do have a nice, really big hill. We live by Westminster College, so there's a really nice hill at Westminster that we would always go sled riding down as kids. And now that my niece and my nephews are about that age, it's really fun to do the same with them. So we'd build like big ramps out of the snow and just go down that big college hill. So I think that would be something that I'd like to do on a snow day is go sledding with my niece and nephews.
Be a lot of fun.
And have some hot chocolate.
Oh, yeah, definitely with marshmallows.
Oh, yes. You have to have the marshmallows.
Yes.
So it is almost Christmas time, holiday season time. So what's your favorite Christmas movies?
My favorite Christmas movie is called This Christmas. It came out in 2009. I don't think many people know about it, but
Is that the one with Chris Brown?
yeah,
a really
and
good
Idris
movie.
Elba
Yes.
and just a bunch of famous people in it. But it's a great movie. It's just about a family during Christmas time, 6 siblings. They all have something going on in their lives that's a struggle, and they're coming together, having their crazy lives together, sorting everything out. And I really, really like that movie. I watch it every year.
It's a classic.
That's my favorite Christmas movie of all time.
I'm excited to watch it because I never did.
Yeah, I'll have to check that out.
I'm going to have to check it out.
Would recommend.
Yeah. Thank you.
Of course.
Thank you so much, Jordan, for spending some time with us today. And before we leave, is there anything else that you would like to say or get off your chest?
No, just thank you for having me. I really enjoy my job and I love the kids that I work with. So I'm excited to keep doing it and make more memories.
Sounds great. Well, once again, thank you so much for joining us on the podcast episode this week. And of course, we'll be back next week with another special guest. So tune in.
Bye-bye. Have a wonderful rest of the day, everyone. Bye.